Welcome to Take 5 Season 4, Episode 9. My name is Tinaye Muzamhindo. I am a member of the Chisipiti Seventh-day Adventist Church in the Health Department. Today, we are going to talk about another health and wellness topic. And our topic today is Genito-urinary System. The genito-urinary system is also composed of two elements, as we can see from the name. It's got the genital system and the urinary system. The genital system is also called the reproductive system. The reason why these two are usually described together is because in the anatomy of the body, they are closely related. So even when it comes to describing them, it's better to describe them together, the reproductive system and the urinary system. So what is this genito-urinary system? The genito-urinary system is the system that has all the organs to do with reproduction. So in the male, it will be the male reproductive organs and the male urinary system organs. And in the female, it will be the female reproductive organs and the female urinary system organs. So that's what the genito-urinary system is composed of. These two systems are obviously connected to the rest of the body. The whole body works together as one unit, and they all rely on each other. All the systems help each other to make sure the body remains well and healthy. When there are genito-urinary system problems, where do the problems arise? They arise in the organs that we have described. They arise either in the male reproductive organs or the male urinary system organs, or if it's in the female, it's also those organs. And you will see signs and symptoms in those areas. When there is a genito-urinary system problem, what should you do? In this system, you are obviously going to recognize the problems very early, because this system never stops working. Like all the systems, they never stop working as well. But with this one, it's so obvious because every minute, every second, there's something happening. And if there is a problem, you quickly realize that there is a problem. One of the most common signs and symptoms that you realize are that if there is an infection in this system, there will be pain. It's a very sensitive system when it comes to pain, because when there is inflammation, there is swelling, and this system has got small organs which are very sensitive to change. So when there is a change, because of whatever problem, there will be pain. And also, what you also see is that there will be increased frequency of passing urine. So whether you're a male or a female, if there's any influence in this genito-urinary system, particularly on the urinary side, you're going to see frequency of going to the toilet to pass urine. And the urine may be a different color from normal. Normally, urine should be almost colorless. So when the color changes to either a dark Coca-Cola color or to a reddish color or any other color, then you realize there is a problem. Sometimes it may just be concentrated, and if you drink water, that color will go back to normal. But if it's a reddish color or it's a dark Coca-Cola color, already you realize that you need action where you may need intervention from a healthcare provider. Who is affected when it comes to genito-urinary problems? Anyone can be affected, of whatever age. With younger persons, obviously it's difficult to realize what the problem is. But as we mentioned earlier on, if it is a child and they are continuously going to the toilet to pass urine, then obviously you will realize there's a problem there. Or if the color of their urine changes, then you know there's a problem there. Or if there is a discharge of any color, because naturally in the genital system or in the urinary system, there should be no abnormal discharge. Whatever color that discharge is, whether it's milky, whether it's yellowish, whether it's greenish, any discharge shows that there's a problem going on. It could be an infection or it could be a blockage problem. And whatever that problem is, need the help of a healthcare provider, because the system will be showing you that there is a big problem. When there are genito-urinary system problems, how are they managed? It depends on the problem. If it's a minor problem, if you drink water or if you rest, it may go away. But if you see the problem is lingering on beyond 24 hours, or even sometimes it may be immediate and the pain is just too much to handle, then you know you don't even have to wait for 24 hours. You need the help of an expert. So you need to be aware of what kind of problems you can deal with and which ones you will need help from an expert.
Take 5 is a show produced by the Chisipiti Church, a fountain of love, and is made possible by support from many partners. If you wish to follow more of our studies on these and many other subjects, please connect with us on the Chisipiti SDA Church on YouTube, Facebook, and Twitter. Like our platforms and share with us your comments. We also have our plug-in team ready to pray with you and encourage you through life's challenges. So please connect with us and would love to pray with you. We can't wait to hear from you. And remember, when life seems to drown you, just take a moment, take a break, and take 5 to reflect.
In conclusion, we know that 3 John 2 says, God wants you to enjoy good health, and that you may go well in all the days of your life. We hope this episode will help you achieve that. I hope you join me in the next episode for another health and wellness topic.